licensure, certification, diploma. I know it's confusing because it's confusing for us. But let me take this opportunity to explain this to you. Because a lot of professionals, I'm not even going to call them professionals, are taking the opportunity of this confusion and to misguide you, mislead you, or worse, making you believe that you're safe to perform a procedure that is probably out of their scope. They're not even supposed to do. So, and this is why it's important for you to ask questions and don't feel ashamed to know your rights and request your rights. So first, let's just start with what is the difference between all of those? So let's start with diplomas. Diplomas is what people love to put it on display because they look nice, they look fancier, but is a document that universities or community colleges provide at the end of the enrollment. So if you pass with stellar grades and you conclude your program, that's what you're going to get, the diploma, all right? But diploma, it's not necessarily means you're ready to serve the public or to use as your proof of professionalism, because you still need to go through the board. And that's the next big thing, boards, because the boards are like departments controlled by the state, which each state is different and works individually, independently. So the board controlled by the state will test you to see that even after you get all those years in the diploma, you're actually ready to perform your service. So, all right, wait. You're telling me that even after I spent all that money in 6 long years in university, I'm still not able to open my shop and see clients? Yes, that's exactly what I'm saying. And this works for all types of profession. Doesn't matter. You could be a lawyer, you could be a dermatologist, you could be a nurse. You are controlled by a board. All professions has a board, a department that is controlled under the state that will test to see if you're qualified to start to see public. And that's simple. And I think it's a nice thing because they're making sure you comply with the law. Since each state has different laws, of course, you have to go through the board. So we're talking about a test. So difficult that you take a class to pass the test, even after you have your... Okay, are you now getting the seriousness of this? Because even after those long years, in the eyes of the board of the state, you're still not qualified. You're still not allowed to see the public. Oh, Belle, but it's too complicated. I feel bad. Imagine you just came from Brazil or you just came from, I don't know what kind of country, and you're qualified. You have all the certifications. You have all the stellar diplomas. And here you'll have to go through all of that. I think I'm okay. But guys, the thing is, why this is serious? Because in the United States, they won't even sell you. They won't even give you the tools and the material for you to perform and work in your line of work if you don't have the license. I'm talking about materials like Botox, fillers, even the enzyme that dissolve fillers, chemical peels. The material that is actually from the States that have been passed through a lab, right? A pharmacy that was been manipulated here in the United States, that have been shipped by a company that understand the temperature of that product and the time management of that product to come out of the pharmacy and go directly to your office. Because time management is really important, as some of those prescriptions are sensitive to sunlight and heat. I'm telling you, they won't sell it to you if you don't have a registration. Pharmacies will require your registration. They will require the registration of your medical director. They will require your NPI number. That is another license, another number that you need to acquire in order to have that product delivered to you. But I have a buddy. I know someone that is a dentist, that is a doctor. She's going to help me out. She's going to purchase and give it to me. Still, you as a consumer should know that this is dangerous because you pinpoint a product that has been time managed and packed in a specific way to preserve and to help with the safety, and you just transporting you God knows how, sending you straight to your clinic and injecting in your patients God knows how. It's crazy. You should know. I see. This is my wall of fame. Those are my registrations and my licensures. This has weight, okay? This has a weight with the state. This is what you're supposed to see when you walk inside of a provider's office. And by the law, it has to be in display. Every single professional, they do have a registration number, which is public. With this number, you can log into the website of the board and see if they're qualified. You'll be able to see their full name displayed with the number. If you don't have the number and you don't have the name of that professional in the board, you can ask them for their credentials. If they refuse to give you, say like that, they have it, but they don't have it now, or that is really, really concerning because they know the law. The reason why I'm sharing and making you guys aware of the difference on licensure is because we've seen a lot of bad things in the news right now. So if you take a look, it's just like on the reach out for your thumb. You just type like on Google and say Florida women was arrested, cases of botulism in Maryland. Those things are serious things. People are really putting other people's lives on account for money, which is not nice, and causing permanent scars, changing people's life forever. There is a case now not too long ago here in Orlando that the lady was in the hospital with necrosis on her neck because she had an endo laser performed by a non-registered person. And this is going to change her life. So the reason why I'm trying to educate you guys is because the difference of this person that have no license whatsoever and a doctor that have the license, and it could have happened to anyone. It could have happened with a doctor with over 18 years experience. And that's true because I am a nurse and I've seen doctors with long time experience having managed some issues with patients performing endo laser. So I know, I've seen. But the difference is these doctors with over 18 years experience, they do have a registration and they will carry a malpractice insurance, because if you don't have a registration, guess what? You're not allowed to have a malpractice because no insurance will take you as an unqualified professional. If you don't have a registration, you don't have a malpractice, which is not going to bring that face of person back, but it will make a big difference at the end. So let's all question ourselves and be more proficient. Asking your provider for qualifications and registration. Asking your providers for malpractice insurance, because it will make a difference at the end, knowing that you're in good hands, you're safe, and you have all the backbone of a service provider that will be able to perform safely. And this is serious because I'm tired of having to respond for other professionals, people that do not have any qualifications, performing for cheaper, for botched service. I lost count how many times I saw people walking through their door with botulism, with infection, inflammation, or even necrosis, and we have to send them straight to the hospital because of a person decided to make money. So now here at Bella Aesthetic Club, every time you walk through that door, you will see all our registrations and qualifications. And let's see, you're coming to see other providers, you're coming to see a hairdresser, you're coming to see an esthetician, you will see their licensing display. And I'm so proud to show you guys that we offer that, but this is not supposed to be something to be proud of. This is something supposed to be a normal thing. When you walk to a beautiful office or a simple, very tiny, small office, doesn't matter. Every time somebody hands their hands on you or they put their hands on you, you should see this document displayed on the wall. So it doesn't matter if it's a hair, like I said, or if a tattoo specialist, anyone, you will see this on display with all of us. And another thing really quick before I go. If you see a provider with a registration for esthetician, beautician, facialist, cosmetologist, they are registration, but however, they are not supposed to perform injections. Injectables are under the scope of the nursing board and the physician's board. And even me as a nurse, I would not be allowed to inject you guys with anything if I did not have a medical director, a medical MD, physician supervising me as my medical director. See how important it is? It won't count if it's and you as an esthetician or beautician or cosmetologist know better. Because if you have that license, it means you sit on a board and you answer questions. So you know better that you're not allowed to do any injectables. You're not allowed to perform. It's out of your scope of practice. And you are going to be in big trouble if they find you doing it. So if you see a provider in their office, a big display of a registration or a certification, you see license, okay? And it is the state, it's Maryland, it's Virginia, it's DC, or it's Florida. Read to see if it's a nursing under the supervision of an MD, if it's a physician assistant under the supervision of MD, if it's a nurse practitioner under the supervision of an MD. None of us could do it without an MD. And for my fellow estheticians or cosmetologists, let me just say something. If you think you're just going to lose your license because you're injecting a patient or it's like performing a service that's out of your scope of practice, think twice. Botox follow under controlled substance because it is a drug. So it's a felony, a federal crime if you do inject or offer Botox, because unfortunately or fortunately, you should have a license to prescribe Botox to a patient. That's why us, even nurses, we do need a doctor, an MD, to sign for our services, because Botox is not just a chemical peel or a moisturizer that you put on people's face. Is a prescription, and it will follow into felony category. You will follow under the criminals that go to jail and under arrest.